Have you ever wondered if it's still normal to masturbate at your age? Maybe you don't talk about it with anyone, not with your friends, not even with your doctor, but it's still part of your private life. You might ask yourself quietly, is this harming my heart? Is this bad for my prostate? Does this mean something is wrong with my desire or my marriage? If you're an older man and you masturbate, this video is for you, not to judge you, not to shame you, but to give you calm, honest medical guidance. I'm Dr. Rosalia Viterbo. I work with many older men who carry this question in silence. They worry about their health, their energy, their masculinity, and they're often afraid to ask. In this video, I want to answer the questions you might be too embarrassed to say out loud. What is normal? When is masturbation safe? When can it be a warning sign? And how does age, blood pressure, heart disease, or medication change the picture? You deserve clear answers, without myths, without fear, just science, experience, and respect for your privacy. So if you've ever felt guilty, confused, or worried after masturbating, stay with me. We'll talk about what is healthy, what to watch out for, and how to protect not only your sexual health, but also your confidence and peace of mind. Let's be honest, sexual topics in older age are often treated like a joke or simply ignored. But for you, it's not a joke. It's your body, your desire, your health. As men get older, many things change. Testosterone may slowly decline. Energy feels lower. You might have more health problems, like diabetes, high blood pressure, or heart disease. At the same time, your brain doesn't suddenly stop being sexual. You may still feel desire. You may still enjoy touch. You may rely on masturbation when you don't have a partner or when your partner is not available or interested, and this can create a quiet conflict inside you. On one side, your body and mind say, I still want this. On the other side, you hear messages from society. You're too old for that. You should focus on other things. Or you hear myths like masturbation will drain your strength, or it will damage your prostate. So you end up with questions you don't say out loud. Is this normal at my age? Am I overdoing it? Could this harm my heart or blood pressure? Is this why I feel tired, or is it something else? Maybe you've noticed changes in your erection, or how long it takes to reach orgasm. Maybe you sometimes feel pain, dizziness, or chest discomfort, and now you're scared to continue. You might also feel emotional effects, guilt, shame, confusion about desire, worry about whether this means something about your marriage, your faith, or your identity as a man. All of these concerns are very real and they deserve a serious, compassionate explanation. In this video, I'm not going to tell you simply yes or no. Instead, I'll help you understand what happens in an older male body during masturbation. We'll talk about when it's healthy, when to be careful, and when to speak to your doctor. Because when you understand your body, you can choose with more confidence, more safety, and more peace. Now let's go step by step. I want to give you calm, clear guidance, not to control you, but to help you make informed choices about your own body. First, understand what happens in your body when you masturbate. When you become aroused, several things happen. Your heart rate goes up. Your blood pressure rises a little. Blood flows more to your genitals. Your breathing becomes faster. This is very similar to what happens during light to moderate physical activity. For a healthy older man, this is usually safe. It's like walking up a small hill or climbing a few stairs. But if you already have heart disease, narrowed arteries, or uncontrolled blood pressure, this extra strain can matter if you feel chest pain, heavy pressure, strong shortness of breath, or dizziness during masturbation. That is not normal. That is a signal to stop and speak to a doctor. Orgasm also triggers a wave of hormones and muscle contractions. Some men feel relaxed and sleepy afterward. Others feel a bit tired for a short time. That's usually normal. But if you feel extremely weak, confused, or unwell after every orgasm, we should investigate further. Your body may be telling you something important. Second, ask yourself about frequency and motivation. Masturbation itself is not poison. There is no fixed number that is dangerous or magical. What matters more is how it fits into your life and health. Ask yourself a few honest questions. Do you masturbate because you truly enjoy it and feel good afterward? Or do you do it because you feel lonely, anxious, or bored, and it's your only way to cope? If you're masturbating very frequently, to the point where you feel exhausted, sore, or distracted from daily life, that's a red flag. Not because the act is evil, but because your emotional needs might not be fully addressed. Also, in older age, recovery time is longer. Hormones shift. Nerves and blood vessels are not as responsive as they used to be, so you may not be able to repeat sexual activity as often as when you were 20 or 30. That is normal aging, not failure. Try to notice patterns. If you feel calm, satisfied, and able to function after masturbation, that's a good sign. If you feel empty, guilty, very tired, or in physical pain, the pattern might not be healthy anymore. Third, protect your prostate, skin, and circulation. Many men worry about the prostate. You may have heard everything from masturbation causes prostate cancer to masturbation prevents prostate problems. The truth is more balanced. Normal, moderate ejaculation does not clog or burn out the prostate. For many men, regular ejaculation actually helps reduce congestion, discomfort, and inflammation in that area. What you should focus on is how you masturbate. If you use very rough grip, or you rush, or you do it without any lubrication, you can irritate the skin and tissues. This can cause small tears, soreness, or decreased sensitivity over time. So, be gentle with your body. Use lubrication if your skin is dry. Take your time. There is nothing childish about protecting delicate tissue. Also pay attention to circulation. If you have diabetes, vascular disease, or neuropathy, nerves and blood vessels in the penis may already be compromised. Very tight grip or long sessions can sometimes worsen numbness and discomfort. If you notice reduced sensation, bending, pain, or plaques, hard areas, talk to a doctor. These can be early signs of conditions like Peyronie's disease or vascular problems. Fourth, consider your heart, medications, and existing conditions. Many older men take medications, blood pressure pills, diabetes tablets, cholesterol medications, sometimes antidepressants or anxiety medications. Some of these can affect sexual desire or erections. You may notice weaker erections or longer time to reach orgasm. This can be frustrating and may push you to stimulate more aggressively or for longer. Instead of blaming yourself, remember this: your body is working under different conditions now. It's not about being less of a man. It's about adjusting expectations to your health reality. If you have a history of heart attack, stroke, serious arrhythmia, or severe shortness of breath, you should discuss sexual activity, including masturbation, with your doctor. Ask simply, is sexual activity safe for me? If your doctor says it's safe for you to walk briskly or climb a couple of flights of stairs, then masturbation at a similar intensity is usually safe too. Watch for warning signs: chest pain or pressure, strong shortness of breath, irregular heartbeat you can feel, severe headache, sudden vision changes. If these appear during or right after masturbation, stop. Seek medical attention. Your life is more important than any single sexual release. Finally, take care of your emotional and relational health. Sexuality is not only physical, it's also emotional. It's linked to confidence, intimacy, and even how you feel about aging. Some older men feel guilty after masturbating, maybe because of religious beliefs, maybe because they feel they are cheating on a partner, even if there is no actual betrayal, maybe because they were taught as children that it was dirty. I want you to know, feeling desire, even at an older age, is human. It means your brain and body are still alive and responsive. If you are in a relationship, consider how masturbation fits into your intimacy. For some couples, it is simply a private, personal thing, and both partners are comfortable with it. For others, it becomes a source of distance, especially when communication is weak. You don't have to share every detail, but talking honestly about changes in desire, erection, or frequency can actually bring more understanding and closeness. If you feel your masturbation is driven by sadness, loneliness, grief, or unresolved tension, think about adding other forms of support. Talking to a therapist, joining social groups, spending more time outdoors, taking care of your general health. Your sexual life is one part of a bigger picture. When your heart, mind, and body feel more balanced, your sexual choices also feel healthier and more peaceful. Remember, masturbation in older age is not automatically a problem. What matters is context, health, and how you feel during and after. My goal is not to stop you. My goal is to keep you safe, informed, and respected as the man you still are. Let's bring everything together calmly. I want you to leave this video feeling clearer, not more confused. You are an older man. Your body has changed, but your sexual feelings haven't simply disappeared. That is not a disease. That is being human. We talked about what happens in your body when you masturbate. Your heart rate goes up. Your blood pressure rises slightly. Your breathing gets faster. For many men, this is similar to light exercise. If you are generally healthy, this is usually safe. If you have serious heart disease, uncontrolled blood pressure, or other major conditions, you need to be more careful. Symptoms like chest pain, strong shortness of breath, or dizziness are not just age. They are warning signs to take seriously. We also talked about frequency and motivation. There is no universal correct number. The key questions are, does it leave you feeling okay or drained and guilty? Is it a peaceful part of your life or is it controlling you? Your prostate and skin need care too. Gentle touch, lubrication if needed, avoiding rough, rushed habits that can cause irritation, pain, or reduce sensation. These are small changes that protect your body in the long term. We also looked at the effects of medications and chronic diseases. Erections may be weaker, orgasm may take longer. None of this makes you less of a man. It just means your body is older and needs a bit more patience and understanding. And finally, we talked about the emotional side. Guilt, shame, loneliness, fear of being too old for pleasure. Please remember this. Your worth is not measured by how often you have sex or how strong your erection is. Your value comes from your whole life, your relationships, your kindness, your experience, your heart. If masturbation is a calm, private way for you to release tension and feel close to your own body, and your health allows it, it can be part of a normal sexual life in older age. If it brings you pain, fear, or deep emotional distress, then it's a sign to reach out for medical guidance, emotional support, or both. Always listen to your body, respect its limits, and treat yourself with the same compassion you would offer to someone you love. If you're still here with me, thank you. This is not an easy topic to listen to, and it's even harder to talk about. By watching this video, you've already done something important. You faced a private question with honesty instead of fear. That tells me you care about your health, not just your pleasure. If what we discussed today helped you understand your body a little better, I invite you to stay connected. On this channel, we talk about men's health, aging, sexual function, energy, mood, and real-life medical decisions, calmly, respectfully, without judgment. So if you'd like more doctor-led explanations like this, consider subscribing. You can also turn on notifications so you don't miss new videos that might answer questions you're still too shy to ask in person. And if you think another man in your life could benefit, maybe a friend, a brother, or even your partner, feel free to share this video with him. Sometimes one honest conversation can change how a person sees himself. Thank you for trusting me with your time. Take care of your heart, take care of your mind, take care of your body, take care of your health, and I'll see you next time.